Welcome to the Gastrointestinal Endoscopy Author Interview Series. I'm Dr. Glenn Eisen, the Editor-in-Chief of GIE, and today I'm accompanied by Dr. Mohamed Othman, who's an Assistant Professor in the Division of Gastroenterology at Texas Tech University at El Paso. We'll be discussing his paper, Conservative Management of Cholelithiasis and its Complications in Pregnancies Associated with Recurrent Symptoms and More Emergency Department Visits. Welcome, Dr. Othman. So I thought this was a very interesting paper that you submitted to GIE because we really don't know much about what to do with these patients. They're very difficult patients. I really don't like hearing whenever I get a consult and it's a pregnant woman.
Yes.
And certainly they're more likely to have biliary colic. So how did you decide to do this paper?
Well, it's the same problem that every maybe 2-3 weeks we would get this one consult of pregnant patient. When I trained at University of New Mexico, we had large Hispanic population, and as we know, they have more prevalent gallbladder disease. So there was a lot of biliary colic patients, and I saw that we're doing many ERCPs and many cholecystectomies for this patient, maybe more than any other institutions. And this is where it came to me that maybe we should look at the outcome of this patient. One thing, very interested that you would find the surgeon or gastroenterologist who doesn't want to touch the patient at all, and the other one who would say, no, we should do something for her. And then, but there is no data to say or to support this opinion or the other opinion. And
Right.
that's why I came for this idea.
So your group didn't have an algorithm as to how they'd manage these patients? It was just essentially which attending was on that day?
Exactly.
Okay. Had your division experienced any adverse outcomes by either not acting fast enough or perhaps intervening and adverse things happening?
I think they had adverse event of not intervening. That patient keep coming back and they end up eventually having cholecystectomy, or they had bad pancreatitis and they end up staying in the hospital for a long time. And actually this is one of the triggers to do the study.
Okay. So tell me a little bit about the study cohort.
So the cohort of the study involved pregnant patients who were presented to University of New Mexico in the last 10 years, in fact from 1999 to 2009, and these pregnant patients were divided into two groups. One of them, the one who had conservative treatment, which is basically antibiotic, IV fluid, expecting management, as we call it in another way. And the other group is a group who have active intervention, such as ERCP or cholecystectomy, mainly laparoscopic cholecystectomy. The study cohort involved 112 patients.
Now, what did you find as far as the complication rate comparing early intervention versus late intervention or no intervention?
So in our cohort of the 112 patients, where we had 68 of them had conservative treatment and 44 has active intervention, we had very interesting findings. The first finding was that patients who had conservative treatment were more likely to present again to the ER. Also, patients who did have conservative treatment and not active intervention were more likely to have recurrent symptoms, and they were more likely to be hospitalized. Another finding, this patient also were more likely to have a C-section at the labor. We did not find a difference in the fetal birth weight between the two groups, but there was tendency that the conservative group has a lower birth weight.
A lower birth weight?
Yeah.
Okay. There were no adverse fetal events because of either intervention?
Actually, there is no adverse fetal events from doing active intervention such as laparoscopic cholecystectomy or ERCP.
Were there any procedurally related complications from the ERCP or the cholecystectomy?
From the ERCP cohort from 15 patients, there's one patient had pancreatitis, but this resolved in 3 days. The other patient did very well. Laparoscopic cholecystectomy group, they had minor complication, or what we call biliary spillage. But other than that, there was not something. There's actually another patient had a preterm labor, but this was the only major complication there.
So have these findings changed the way your group practices with regard to these patients?
Of course, because this was proving that active intervention, in fact, improved the patient outcome and decrease the morbidity of these patients. And this finding made us, after that, be more proactive in this patient. I'm not scared to do ERCP. I'm not scared to do laparoscopic cholecystectomy if we have to.
Okay. And your partners agree with this? They're willing to do early intervention?
I think after this study now they are convinced, because most of them, they are the one who did the ERCPs and who are the ones that did laparoscopic cholecystectomy. And most of these cases will need surgery and GI opinion together, and getting both department and look at both procedures together. It was very important because it convinced them that active intervention, especially in the second trimester, is safe and also can prevent later complications.
Thank you very much, Dr. Othman.
Thank you.